30 seconds. 30 seconds. In 10, 9, 8, 7, 6, 5, 4, 3, 2, 1.
Good afternoon, everybody. Hope you had a great weekend, especially Saturday. That was nice. Here with Josh and Paul, of course, and Pastor Montz from the Citadel of Love in North Hartford. He's going to talk for a few minutes. COVID is not the only thing that's stealing lives. So is gun violence and what that means to our community. And Pastor Montz can talk a little bit about what he's hearing here in Hartford and what he's saying. Let me tell you first about our COVID daily summary, going back 3 days for Friday. What I think you see here is our numbers have stabilized, and I think that's better than some of the alternatives. 3% positivity rate, hospitalizations down a little bit over the last 3 days. Fatalities up, that's a 3-day number. Overall, our positivity rate is a little bit lower than it's been over the last few weeks. I think we're making progress. That said, look around the rest of the world. You can see Europe is flaring up in lockdown. India is flaring up in lockdown. Brazil is flaring up in lockdown. Idaho and Michigan here slightly closer to home. In certainly Michigan locking down. So we take nothing for granted, but I think we continue to make good progress here in our region, particularly here in the state of Connecticut, in part because of the vaccine. And we're having good progress in the vaccine. Look, we finally have a majority of the people of Connecticut, the adults, have been vaccinated. 52% of adults 16 and above have received the vaccine. I'm particularly impressed that 83% of those 65 and above have now been vaccinated, have had their first dose. 83%. You maybe remember going back a few months, 50% are vaccine hesitant, 50% may not get vaccinated. What are we going to do? I'd hope that 65 and above are canary in a coal mine, and you see that that's 83%, 71% of 55 to 64. I'd like to think those numbers continue to go up as we move towards really herd immunity. 16 to 44, that's 30%. That's up from 20% just a few days ago. Very important that young people continue to get vaccinated as they've been doing. That's really what's going to protect us from what you see going on in some of these other countries and regions of the country. We expect from Pfizer in particular eligibility for vaccinations to open up. Right now, they're the only ones to do 16 to 18. Everybody does 18 and above. It looks like Pfizer is going to get a green light in the next month or so for a younger demo, 12 to 15. That's really important because it's the younger demographic where not suffering many complications, but suffering a lot of infections. So really urging them to get vaccinated, and really hopeful that the younger age group, 12 to 16, will be able to be vaccinated and vaccinated soon. The only worry I see in these numbers is J&J. They hit a speed bump at their Maryland manufacturing facility. We're receiving less vaccinations this week than we did last week, gone from about 288,000 last week to about 180,000 or so this week. That shortfall is really all related to Johnson & Johnson. And I'm afraid we don't have any clarity on what we can expect next week, but we'll be ramping up again, but perhaps slowly. That said, more positive, there are vaccine appointments available. Probably in the morning is the best time to try. Every day we get new vaccines available, not as many as we had the week before, but still tens of thousands. And those are tens of thousands of appointments opening up every day. You could have found appointments this morning for later today. I haven't been able to say that in some months. You go to ct.gov, COVID vaccine, or dial the telephone, 877-918-2224. And do us a favor. Let's say you were there refreshing, you couldn't get your vaccine appointment for 2 weeks, then you checked and you got a vaccine appointment for tomorrow. Please cancel the other vaccine appointment. Makes our lives a lot easier and makes one more person eligible a little bit sooner. Next up is from our friend Red Gidi, who was co-chairman with Deidre of our vaccination advisory group, head of Trinity Health. They did a vaxathon. They did it here in Hartford. Sort of everybody's trying different ways to get your attention, get you there. This vaxathon was 24 hours, round the clock, led by 300 volunteers who made an enormous effort. There at the 4,000 people got vaccinated over the course of that 24-hour period. Over half of them people of color, for which we're very thankful. So to Reg and the Trinity Health team, well done. We continue to do everything we can to bring vaccines to the people, make it easier for you to get vaccinated, no questions asked, free of charge, and increasingly you don't need an appointment, just come and get vaccinated. You can see that FEMA mobile unit, the one that vaccinated thousands of people in Bridgeport, is now moving on to New Britain, North Canaan, Winstead, and Hartford. You can see then the Griffin mobile vans, which are the smaller ones, a little like the ice cream truck in yellow down there. You see where they're going. Sort of easy. Just go to the mayor's website, go to the East Hartford Facebook page. You'll be able to find, when the van's going to be there. And also, as you know, we've had hundreds of people knocking on doors, making telephone calls this weekend, last week, going forward. They'll be doing that in New Haven and Waterbury and Hartford and Hamden. Just reminding you the van is going to be there. If you're in Winstead, by the way, and you get that shot, you may go to the American Mural Project. I was there this weekend. It's quite remarkable. Celebrates people who do the work in our country. All right, so encouraging people to get vaccinated. I think this is important. There's a lot of noise about Big Brother and vaccinations. You have no right to ask me and the such. I'm finding as I look around the state and our country and even internationally, people are doing everything we can to encourage you and incent you to get vaccinated and give you the right to, make sure you're there with other people who have been vaccinated. So a couple of little headlines that Josh found I thought were nice. Shot for a shot. New Orleans bar. You get a vaccine shot, you'll get a free shot of alcohol. Come on in. Free with your COVID shot. You get a beer, arcade tokens, Krispy Kreme donuts. Remember, you get a donut a day as long as it lasts if you've gotten vaccinated. So maybe we should move those mobile vans up to the Krispy Kreme locations. You can get a twofer while you're there. Major League Baseball pushes incentives to encourage all their players to get vaccinated. I was interested. You can now play cards. You can do a little poker even without the mask. Sit in a group if you've been vaccinated. Otherwise, you're going to have to just listen to your iPhone. The Miami Heat, sort of interesting, down in Florida. I didn't know the governor liked this, but they've got a special VIP section for Miami Heat basketball fans. VIP standing for Vaccinated Important People. And there's sort of courtside seats, preferred seating, and you're sitting next to somebody else who's been vaccinated. Movie theaters, free popcorn. We're doing everything we can to encourage you to do the right thing for you in your community. And finally, I'll just take this before I pass the baton. We're making good progress in terms of our proms, graduations, parks, beaches. In terms of proms and graduations, a lot of questions, a lot of planning going on. I think you should be able to count on it. We're going to be able to get this done. I would urge the later you can book it, the better. Just give you a little more flexibility in case something untoward happens. I think we'll be in pretty good shape. The later you do it, the warmer it is, more likely it is you'll be able to have that graduation or prom outside. The later you do it, the higher the vaccination rates we have. What a difference that's going to make. And I was, in Berk Hempstead at one of their beautiful parks, the People's Park, on Friday with Katie Dykes. I was amazed. We kept our parks and our beaches open all during 2020 and now. They're open at full capacity now. Last year, they were open at partial capacity just because we didn't want things to get too crowded. and it was the busiest year in our history for our parks and beaches. People really love, if you're going to suffer through COVID, being in a state like Connecticut where you can get outside, a little fresh air is a really important thing. But that said, let me pass the baton over to Pastor Motz. It was a tough weekend, a really tough weekend, a weekend with two needless gun-related fatalities, a 3-year-old and a 16-year-old. And Pastor Motz is on the front lines when it comes to talking to young people, talking to their parents, COVID and violence. Pastor Motz, thank you for being here with us.
Thank you for having me, Governor. I do want to just say thank you so much for your leadership to our state, especially during the last year. We really do appreciate you. I am challenged, however, after talking with so many people about what happened on Saturday. And first, let me say and give my condolences to the family of Rondell Jones and the family of Jamari Preston. Very senseless killings, unnecessary, beautiful children with a great future in front of them, dreams. Their families had dreams for them. And to have something like this happen is just devastating. My mother was, impacted by this. I have a 3-year-old granddaughter. And so this just sort of shook me in a different way. And I really feel what is going on right now, Governor, is that we're fighting a spirit of fear. The vaccine has gotten people afraid. The virus has gotten people afraid. And now there are people who are afraid for their own vitality. And one of my favorite Bible verses says, God has not given us a spirit of fear, but of power, love, and a sound mind. And I am praying and I am hoping that we as a community would come together in the power of love to heal, to bring strength, and ultimately to bring victory to our entire community. But we have got to come to some kind of way where we look at our hearts and we see, is this the Hartford we want? Is this the Connecticut we want? Is this the world we want where our children are being killed? It's one thing when people can make decisions to do certain things, but a 3-year-old, I mean, come on. We've got to fix this, and we've got to fix it fast. We've got to get love in our homes. We've got to get love in our community. We've got to love one another, and that starts with, I believe, with forgiveness. Let's stop placing blame on other people, and let's just forgive and move forward into how we're going to make our community better. I'm so happy to hear about the Vaxathon that happened this past weekend. To hear so many people got vaccinated. We can't walk in fear. When I was a kid, I couldn't go to school if I didn't get vaccinated. Let's be safe. Let's care about each other. Let's love each other. And then let's make Hartford and let's make Connecticut better. I believe Hartford is not just the city of God, but Connecticut is the state of God. This is where God reigns. I know they call us the chosen frozen, but we know this is where the Spirit of God is. But we need to love each other, and we've got to come together and figure out how to do this.
We got to care about each other. We got to love each other, as you say, Pastor. We remember Rondell, remember Jamari. Our hearts go out to their parents and their friends. Pastor Mott also is a pastor to the police chaplain. He knows how people are grieving across this city and this state.
Absolutely.
With that,
can I say this? Can I very quickly?
Please.
The police are going through too. I've spoken with them as well. They're challenged because they want to do the very best job that they can. Every single police officer that I've talked to says, I took this job to help people. And they're feeling like their hands are tied. It's just been such a crazy time to go from 8 murders in all of 2020 and now 8 so far in 2021. My mother said something. She said, I almost wish we were on lockdown again. And I know nobody wants that, but we have got to figure out we cannot have our police stressed and traumatized. while we're stressed and traumatized, and then health workers are stressed and traumatized. We got to take a break. We got to take a breather, and we got to work hard to come together and help each other.
Yeah, as you say, caring and love for one another, that's the vaccine to prevent gun violence as well.
Yes.
Any questions? Josh and Paul are here as well.
News 8.
Good afternoon, everyone. Governor, you talked again about the amount of J&J and how much less than we had been getting. Because of that, and again, you mentioned the vans going out, will you make them exclusively? Is that the one place that Johnson & Johnson, because there's so few now, is that the one place you'll bring him in those vans to get to those areas?
Yeah, Josh tells me we prioritize every J&J we have to those mobile vans. Is that exclusive right now, Josh?
There's a couple other very small areas where it's needed, but the vast majority of the Johnson & Johnson we have is going into the mobile units, and for now, at least, we think we're able to continue to fully supply them.
And Governor, with respect to, you mentioned again graduations and proms, and that you remain confident that those will happen. As far as it being later than, or as late as possible, obviously there's a certain time frame that are under there. What else can you say about both the graduations and proms at this time?
I can tell you that it's warmer and you're more likely to be vaccinated in June than you are in May. I can tell you that I feel very confident that your prom and your graduation is going to take place, hopefully outside, and get vaccinated. Then everybody around you can be as safe as you are.
Channel 3 Eyewitness News.
Yes, Governor, kind of following up on that question, as the variants spread, especially among younger people, what measures are in place right now to track this in the schools, especially as, the prom and the graduation guidance was released today?
I can tell you, as we look around the rest of the country, you're right, Matt, we've seen school-related sports have been a source of some flare-ups. We've had some teams that have had to quarantine. Generally, the schools sort of reflect the community spread, more broadly. We have not seen as much of that here in Connecticut, and that's one of the reasons we are beginning to emphasize the 16 to 18-year-old and then even the 12 to 15. If we can get them vaccinated sooner rather than later, that's a big plus. But right now, our schools are able to operate safely, for which I'm very thankful.
And a kind of quick question on the Naugatuck Valley, because that was the source of a hot spot last week. Has a potential source for those clusters of cases been identified, especially since the Waterbury Health Department says that there has been a significant rise in cases in those 18 and younger?
I don't think track and trace has identified any one particular thing. I think it's more those informal socializations, maybe a little less likely to wear the mask, maybe a little less likely to get the vaccines, but I don't think there's anything particular. Is there, Josh, that we point to?
No, I think that sums it up well, Governor.
Thank you.
NBC Connecticut.
Good afternoon, everyone. Governor, sticking with the prom and graduation, has there been any changes or expected changes to the number of people that would be allowed outdoors, mandating testing, anything like that?
No changes at this point, but I think outdoors you're going to have a fair amount of capacity there, so those proms and graduations can go forward as planned.
And is it still expected that at the end of April the state will start seeing a vaccine surplus, or has that now changed due to J&J?
Well, you can see we have a little more room right now. As I said, you could have gone on first thing this morning, and there were at least a few spots open for later today. So I think we're getting closer to a balance. I'd like to get those J&J vaccines back in force, but that may be another 10 days.
And lastly, are you continuing to notice hesitancy for some to get the vaccine? And how significant of a hurdle do you see that to get herd immunity? How concerning is it for you?
I'll start by the fact that I'm encouraged that you have over 80% of the folks, 65 and above, 70 above. That's a good deal compared to where we thought we might be a few months ago. I worry that right now the infection rate is highest among the younger folks, especially 20 to 30 years old, the so-called invincibles. So you can see we've made a particular effort to make sure they know how important it is to get vaccinated. So far, they're getting vaccinated. Keep going, guys.
Thank you.
Fox 61.
Hello, Governor. Quick question for you on the LEAP program that you announced today. What problems are we seeing with students in Connecticut when it comes to this absenteeism, and what are we hoping that this program will achieve?
Yeah, the LEAP program is really important. Look, just same way we found that we're knocking on doors to tell people how important it is to get vaccinated. You can't do everything, online. The LEAP program, we're going to have hundreds and hundreds of folks, as well as teachers and school officials, calling, knocking on doors, telling those students, probably 25% of whom have never been back in the classroom over the last 9 months, even though the overwhelming majority of our schools are open for in-person learning. Most of them, almost all of them, for full time, at least 75%. So you got 2 months left. So the LEAP program is knocking on doors, telling you we want you back in the school. You can do it safely. And by the way, here's some programs we're going to have this summer, starting with a summer camp that I know you'll be able to afford.
Thank you. And my second question is for the pastor. What can we do, or what can we ask our community to do to try to curb this violence? When we see something like this with these 2 young lives lost, what is the challenge that people need to meet in order to stop this from happening in the future?
Okay, thank you. I'm not sure that we can stop it from happening, but I know we can start by talking. We have to make people know that it is important. If you know something, you talk about it, you tell someone about it. In addition to that, I believe that we have to return to a kind of civil community where we care about one another and not think the worst of one another. So it starts, I feel, however, in the home. And when we can start to get our homes with more love and more compassion, then I think that's going to spill over into the streets. But it starts with us talking. We've got to talk. If we know something, we got to say it.
News 12 Connecticut.
Good afternoon. A lot of excitement about the potential proms. I'm wondering, why was this something that's important, and how do you think these will look and be different than your traditional proms?
Hey, Josh or Paul, do you want to try that?
Well, our Department of Public Health, in collaboration with the State Department of Education, put out guidance last week because they've been getting a lot of questions from districts and from parents and families. So we appreciate the efforts they put into those guidance, and it will look different. I think as the governor indicated, they'll probably be smaller, much more likely to be outdoors, probably won't run as long, maybe not as many people jammed into indoor spaces, but still, we're very hopeful and excited that there will be the opportunity for something more traditional in terms of proms and graduations, these really important life milestones for our high school students in particular, that we weren't able to enjoy anywhere near the same degree last year. So this is just, one more step, hopefully back towards normal. But as the governor said, message to high school students out there is you've got hopefully a few weeks before your prom to go get vaccinated. That will definitely help reduce the risk. So please, get an appointment, go get vaccinated.
Do you see some good economic impact coming out of this for, vendors in the event sector?
Well, look, every event helps, right? There's a long way to go for a lot of those, event venues and restaurants and others who were hit so hard last year. But we're really hopeful and optimistic that as we get into late spring and summer, they're really going to be able to start to recover a lot of the lost business that they've had to endure over the last year.
And I'm going to ask a question from one of my associates about what criteria would be used to send refugee kids from former juvenile detention from former juvenile detention centers in Connecticut?
The criteria for kids coming up from the border to, for example, our juvenile training facility, is that what you're asking, Suzanne?
Yes, thank you.
Yeah. Look, as you know, the White House has asked virtually every state in the country. They're recommending locations. They'd like something that was, relatively secure, but just as importantly, a place of caring and hope for these kids where they can feel safe and maybe have some outdoors activity, maybe some educational opportunities. So that's how we prioritized probably a recommendation we're going to make to the White House in the next couple of days.
Yeah.
Paul?
I'll add, Governor, it's not only about identifying a potential location to support during this humanitarian crisis, it's also ensuring that the location has the right people and the right services to serve these children who are now in our country, and in this case will be in our.
We lost you, Paul.
Unmute, Paul. Unmute.
Unmute. Sorry about that, Governor. I'll start over. Yes, the governor has basically put forth a team internally led by myself and Commissioner of Department of Children's and Family, Vanessa Durantes. It's not only about identifying a location to support during this humanitarian crisis. It's also about ensuring that you have the right people who are providing the services and have the right services, the extreme wraparound services that are needed for these children who are now not only in our country, but also would be in our state. We have not provided a final recommendation to the White House, but we are in the process of completing our due diligence process at this time.
Thanks, gentlemen.
I should add that whatever happens is 100% paid for by the federal government.
The Associated Press.
Hi, good afternoon. Governor, if we get back to the LEAP program for a second, you announced the $10.7 million today, but the congressional delegation also said that money from the American Rescue Plan will be coming for some more education dollars. Can you quantify how much money and when and what that money will be used for in addition to the money that you announced for LEAP?
Yeah, we're going to get $1.1 billion over the next 2 years. And that money, some of it goes through the state government here in Hartford. Some of that money goes directly to our superintendents and to our schools. I think priority number one is guidance is learning loss. How do we get these kids back up to speed? So as I've said before, that doesn't start in September. That starts in early July. And Charlene, our Commissioner of Education, working very hard with superintendents and the not-for-profit community, trying to put together programs that we can, make available to superintendents so those kids can hit the ground running in July. Not all STEM learning, but also some fun and a chance to socialize and be with their peers so that they're ready to learn in September.
Do you have any details on those camps and those programs? You have mentioned aquariums. You have mentioned other places kids can visit. Who's running the camps, and are those details still being worked out, or do you have some details on that?
Yeah, give us another week on that if you could. We're working with the camps. We're working with the museums. We're working with the libraries. We're working with the aquariums, trying to put together a package that I hope a lot of our superintendents are going to say this is a good way to go.
And finally, vaccine passports. Has there been any more talk about creating something for Connecticut and how people are going to prove they've been vaccinated when they go to a concert or go to some other event?
Yeah, right now you can go to VAMS, you can get proof, you can get that laminated, you can do that yourself. Whether we as the state want to step in and do that like they are in New York, I don't think we've taken that step as yet. But as I've said before, and I alluded to during the briefing, we got a number of businesses who are being very creative about how if you can show you've been vaccinated, you're in the Easy Pass line, you're in a faster line. Other people have to show proof of testing and things like that.
Thank you, Governor. Appreciate it.
Thank you.
The Hartford Current.
Hi. First of all, Governor, I'm just wondering if there is anything policy-wise out of your office or out of the legislature that you think can be done in Hartford to address the type of violence that we're seeing.
Right now, we're not looking at a legislative response to this. I think you heard from the pastor. We're working with the religious community. We're working with families. We're working with Project Longevity. We're working with the community groups, doing everything we can to, reduce the tension and the risk out there. There's not a big spike in violence necessarily around the state or around the country, but it's something we take very seriously. I know what it means to a community.
On another subject, we understand that the percentage of vaccine doses that have gone toward high SVI zip codes actually decreased this past week. Why did that happen, and what is being done to ensure that won't happen again?
Is that true, Josh?
Yeah, and I think it had a lot to do with two factors. One, last week was, as we previously discussed, an all-time record by far in terms of the number of vaccines we received in Connecticut. And a lot of our providers are focused, on our high SVI communities were maxed out, and we were able to give additional vaccine to some of the local health districts in particular in some of the suburban communities or non-high SVI communities. So that local health department category was the one that declined the most and really led that decline week over week. And I think it may have also had to do with the fact the last measurement week straddled when we opened up to 16 and above. So there were a couple factors there. But as the governor described during the presentation, we're really proud of a lot of the work that's going on around the state and in our cities in particular to make it as easy as possible for people to get vaccinated, bring vaccine opportunities directly to them. We're seeing more and more opportunities for walk-up appointments, really trying to tear down every barrier that we can identify to help people get vaccinated as quickly as possible.
So I know that the SVI targets are not a requirement. There's not really any enforcement behind it, but is there any consequence for different parts of the formula that fail to meet those targets, or what can be done to further incentivize or further motivate or further require those targets to be hit?
Well, as you probably know, Alex, the category which has been consistently lowest in terms of vaccinating people in the high SVI communities has been the pharmacies. And we have been talking to our federal partners about additional things we can do there. Those doses are allocated directly through the federal pharmacy program, so we're hoping those conversations can proceed well. We do think we're right on the edge, though, of, as the governor mentioned, as demand starts to taper off a little bit, when it becomes easier for people to get walk-up appointments in the pharmacies in particular. A lot of the pharmacies that are providing vaccine are located in our high SVI communities. The problem is that people who live in those communities often aren't the ones who are first able to get to those appointments in the pharmacies. So we're hopeful that dynamic will turn. That will help a lot. But, again, we're going to continue to push every avenue. We're going to be in a position again in a week or two here where, there's going to be more vaccine available than providers, have the demand for it. We're already seeing some local health departments start to phase out their vaccination programs. So, we're going to keep pushing every angle we can.
And then lastly, what happens if in a future week there isn't enough Johnson & Johnson to distribute to these mobile vans? Is there kind of a contingency plan, or would you have to pull some of those vans off of the road for a time?
No, we want to do everything we can to keep them out on the road. The contingency plans that we're working on have to do with them starting to do mRNA vaccines. So doing the Pfizer or Moderna vaccine, which obviously adds complexity to coordinate that follow-up, the second dose appointment. But our providers are working on how those plans would evolve.
Got it. Thanks, Josh.
Hearst, Connecticut Media.
Thanks. Governor Julia Bergman from Hearst. In regard to the tragedies in Hartford over the weekend, you'd indicated at the outset that gun violence, like the coronavirus pandemic, are both public health crises. So would you consider, have you given any thought to directing some of the stimulus money to gun violence prevention programs?
Oh, that's a very interesting idea, Julia. We did previously because of the nature of the demand with everybody quarantined and what that meant in terms of some spikes in violence going back a few months, and we're ready to do that again as needed.
Yeah, as the governor stated, over the summer, The governor directed federal funds that came to the state to cities such as Hartford, New Haven, Waterbury, and Bridgeport for various means, whether it was to support additional police support and overtime, or in the governor's, as stated, as well as for violence reduction programs within those particular cities. As we get more information on the federal guidelines, we will continuously look at various ways to utilize federal funds to support our state in all various manners.
Thanks. And then I guess for Josh, what is the current total supply of the J&J vaccine in Connecticut? And are there any firmer plans for the colleges? I know there was discussion of at least getting their first dose before they leave for the summer.
Sure. So across all of the channels through which vaccine comes into Connecticut, our state allocation, the federal pharmacy program, and the federally qualified health centers that get direct allocation from the federal government, we're getting about 21,000 doses of Johnson & Johnson into the state this coming week. We don't yet have visibility into what we should expect for next week. And with regards to the colleges, yes, we are working. The governor's been in discussions with the White House and with fellow governors. Our plan there does have to shift. We had hoped to vaccinate them with Johnson & Johnson. We're now going to pivot to providing them with either Pfizer or Moderna and make sure that as college students return from other states, we have opportunities available for them for their second dose appointments, even if that does cross state lines. And we think that should be relatively easy to execute, particularly in mid to late May. I think all 50 states will have plenty of vaccine available at that time.
And is there any travel guidance that might be expected for the college students, especially, if there's going to be a lot of people flying or things like that? Is it similar to what we've seen with sort of testing before they go and testing negative before they go?
Yeah, well, as Governor mentioned several weeks ago, the travel advisory is guidance at this point. So that is best practices, is to get tested before you travel, get tested when you get back. But primarily, the goal is here to get vaccinated. That helps alleviate a lot of the risk, and that's why we're focused on trying to get college students vaccinated in as high numbers as possible while they're still living in their dorms. It's really easy to bring the vaccine directly to them.
The Waterbury Republican American.
Thanks very much. Josh, I had a couple of screens open and I can't seem to find it now. What was the performance in terms of the SBI? I thought I saw something somewhere, maybe 28%, but maybe you could give us what the goal was and what we achieved.
Last week was 22%, Paul.
22%. Okay, sorry. Out of 31?
30. Yeah.
Okay. And what is the mix of vaccines that we're expecting this week? The total doses and the mix. You said I think 21,000 from J&J.
Yep, 98,000 Pfizer and 60,000 Moderna.
Okay. And Governor, or maybe Paul might, or Josh might know the answer to this. I was forwarded an email from an advocacy group that is under the impression that the telehealth order will expire on April 20th, but I thought that was part of the legislative package that was approved going to May 20th. So what's the status of the governor's order on telehealth coverage?
I'll start. I want to keep telehealth. I want to make it permanent in the state, work with the legislature on that, but at a minimum, it's going to go through May 20th.
Okay. And where do things stand with the discussions with the legislature? I know there's bills moving through. I mean, where do we stand on that issue?
In terms of telehealth, as the governor said, there's a commitment that as the administration, we will make sure it's expanded to May 20th. When it comes to the legislature, obviously they have to take up a full bill on their calendars that will pass both the House and the Senate. But as the governor stated, he wants to make it permanent, so we look forward to a bill get to his desk.
Well, I guess I'm trying to get a sense of what the negotiations, because this seems to be one of those issues where there is bipartisan and by governmental branch support for the proposal.
Correct.
It seems like a matter of working out the details.
I'll go even further. There's really no negotiation because the governor's ready for the bill to get to his desk.
Okay. Thanks a lot.
The Day of New London.
Hi, everyone. This is Sten Spinella with The Day. Governor, I wanted to ask about one part of the LEAP program. As you said, it will increase staffing to deploy people to homes of chronically absent or disengaged students and work with their families. I'm wondering who exactly will be employing the staff to work on this retention. Will it be local districts? Will the staff include educators working for school districts?
What we've got is a contract with a group that's going to work with 6 major out groups that'll do the door-to-door and the knocking. We're going to be talking to the Boys and Girls Club, talking to the YMCAs, and getting other not-for-profits involved as well.
So will any, educators involved in school districts be a part of that workforce as well as the people you just mentioned?
I don't think so, Stan. I think they're going to go out and find others who are going to knock on the doors, but it's closely coordinated with the educators, that's for sure.
All right, thank you.
CT News Junkie.
Thanks, Max. This is similar to what you guys have been talking about, but I understand that the Chief Medical Examiner's Office is reporting that there was like a 30% spike in homicides in the state over the year before. That seems like a lot. Do we know what may be driving this and what the state can do about it?
Paul, I haven't heard that number.
I haven't heard that number, but I'll be happy to check on that and get back to you.
Okay. I was also wondering, we were talking, or the governor, you were talking earlier about vaccinating children under between like 12 and 15 years old. I guess pediatricians are saying that they're kind of in the dark about it. Do we have a plan for how we're going to vaccinate those kids when something's approved for them?
Well, I think it's a little premature, Hugh, just because FDA has still got to approve. Rumor has it that it'll probably be in the next month or so with some guidance from CDC on how that's done with parental permission.
Okay. Thank you.
The Connecticut Mirror.
Hey, everyone. You guys recently launched a program designed to help folks in nursing homes get second doses, or for new residents or new workers, get a first dose or a single dose. A lot of that effort, both at the catch-up clinics and the discharges from hospitals to nursing homes, involves a supply of Johnson & Johnson. Do you anticipate having to reduce those clinics, those catch-up clinics, or that effort in any way with the reduced J&J supply?
Hey, Jenna, we don't anticipate having to slow that down. As I mentioned in my answer to the prior question that there were a few other small uses of J&J, this is one of them, where some of our hospitals who are providing Johnson & Johnson vaccination on discharge into a nursing home, there will be some cases where that will continue. And where it doesn't, we're making plans with all of the involved providers to ensure that there's adequate Pfizer or Moderna available, and then coordinating the second dose appointment as well. So that work is critically important to make sure that we stay on top of the very high vaccination rates we have in our nursing homes and not see that slip. And compliments to the team at Department of Public Health, the industry, and our pharmacy partners who are doing a great job there.
Okay, thanks. And then, Governor, the Vaccine Advisory Panel and its subcommittees haven't met in quite a while. How do you view the group's role currently? Do you consider their work to be concluded, or do you have them on standby in case you would need a recommendation for something in the future? How do you see their role?
I think they're definitely on standby. I think Deirdre and Reg talked to them along the way. My instinct is that over the course of the next couple of months, if we find out about vaccines for younger people, if we find out about booster shots, depending on what the variants are, that group could be quite busy again.
Thank you.
Connecticut Public Media.
Good afternoon. When does the state think health providers and centers should considering rolling back their testing services? And does the state have any specific metric or data that they're going to use to start to roll back some of the testing?
Want that, Josh?
Sure. Well, we're going to likely need to continue doing quite a bit of testing for the foreseeable future. I mean, we passed a big milestone today with more than half of the state having received their first dose of of a vaccine, half of the adult population receiving their first dose, but almost half still have not received their first dose. So there's still a lot of unvaccinated people in the state, particularly younger people. That's where we're seeing a lot of cases right now. And so we need to continue testing for a while longer. We'll continue to monitor it carefully. We'll continue to look for recommendations from Commissioner Gifford and her team about different populations we may be able to scale back. But unfortunately, we'll probably be continuing to test for some time longer, and we appreciate our providers who've continued to support that effort for, over a year now.
Do you know what the testing numbers look like? Are they as they compare to the fall and winter months and now?
Yeah, they've been quite steady, actually. I mean, we've had 243,000 tests done over the last week, and that's kind of in the midpoint of where we've been for the last, really since the end of the summer, for months now. So the volumes have been pretty steady. I think you've seen a mix to some degree. We have a lot of hospitals are kind of testing everybody that's coming in or out of the hospital for procedure. It's maybe dropped off in some other areas, but the volumes overall still give us a very good pulse of the activity across the state, still among the highest in the nation.
And last question, I guess, like in a perfect world, when do you think testing would more closely look like we have for the flu, which is primarily done at doctors' offices or urgent cares?
Well, there's already a lot of point-of-care testing going on right now with antigen tests, both, in medical facilities and nursing homes and other places. And we're seeing a lot of additional testing continue, testing innovation continue. You're going to see relatively affordable at-home tests. There's a bunch of them that are queued up for approval by the FDA right now. So I think it will evolve, kind of away from the drive-through mass testing sites that we've relied on so much over the last year to a much more convenient kind of at-home or with your, at point-of-care tests becoming much more widely available.
Thank you.
All right, Max has given me the signal. Let me just say I really appreciate this past weekend. The hundreds of people are out there knocking on doors, telling people how important it is that you get vaccinated. I appreciate the number of people, especially young people, who are out there getting vaccinated. And as Pastor Mons reminds us, not necessarily any vaccine for violence, except for love and caring. Appreciate you, Pastor, sharing your words. Look forward to seeing you soon. Thanks, everybody.